Hi everyone, I'm Dr. Mariska. Today I would like to talk about the importance of giving vitamin D3 supplementation for children in urban areas to help fight against upper respiratory infection. The upper respiratory tract infections is one of the leading causes of death among children under 5 years old in developing countries, including Indonesia. It is also one of the leading causes of school and work absence in both children and adults. The severity of symptoms range from mild nasal congestion, runny nose, cough, sneezing, sore throat, fever, until fatal shortness of breath.
Over the last year, I have observed that the prevalence of the upper respiratory tract infection in our clinic at Bekasi is more than 25% of the total case. This number is quite high.
And I also discovered there are many risk factors of upper respiratory tract infection. The air pollution is the most common problem in urban areas like Bekasi. Bekasi also has high residential density because it is located very close to Jakarta, the capital city of Indonesia. This condition leads to a low hygiene and sanitation in some areas. There is also low measles immunization coverage among children, especially in some conservative religious groups. And finally, of course, there's also malnutrition. According to the 2018 National Health Survey conducted by our Ministry of Health, there were about 13.8% of children under 5 years old were malnourished and 3.9% were severely malnourished. Malnutrition mostly comes as the result of malabsorption issues, for example, intestinal parasites and the poor diet. The survey showed that Indonesian children actually consume less vitamin D-rich foods than the recommended daily allowance or RDA. We have known for long that malnutrition increases one's susceptibility to infection and, of course, prolong the morbidity. So, I thought that in order to help these children to build their resilience against infections, we must first correct their nutritional status and malabsorption issues, while also treating their disease. In this course, we have learned that micronutrients and vitamins play a vital role in our bodies to maintain our physiologic processes and to strengthen our immune system. One of them is vitamin D or vitamin D3. Vitamin D is classically known to have important role in metabolism and bone growth, also to facilitate the calcium absorption in the intestine. But in a recent study, I read that vitamin D also has beneficial effects to our neurons to prevent cognitive declines in the elderly. I also read that vitamin D, especially cholecalciferol, acts as an immune modulator, which helps our body to synthesize antimicrobial peptides needed to fight against pathogens. The study also concluded that the higher vitamin D level in the blood is strongly correlated to the shorter duration of hospital stay in the critically ill children. But the truth is, one of the studies also found that the current status of vitamin D3 among Indonesian children is still below the normal range. That's why many Indonesian children are prone to upper respiratory tract infection. At first, it raised many questions from me. Why are we having vitamin D deficiency although Indonesia has a lot of sunny days? Well, one of the reasons is many of parents still hesitate to give their children vitamin D3 supplements because they still believe we should have gotten enough our vitamin D from our diet and sunlight. But the diet is not enough to raise our vitamin D3, as most of our diet only provides a very small amount of vitamin D. Well, how about the sunlight? The ultraviolet B sunlight exposure is needed for the vitamin D3 activation in our skin. Although Indonesia is located near the equator line, the industrial revolutions have made the cities become more polluted, so the pollution blocks most of the sunlight needed for the vitamin D synthesis. On the other hand, the soil becomes poor in nutrient, so it produces vitamin D poor foods. Consequently, without any supplementary intervention, it will lead to more nutritional deficiencies in the upcoming generations. The other contributing factor is the change in children lifestyle. Nowadays, children are also having less outdoor time because the school hours are longer than before. Children also refuse to play outdoors because they prefer playing games or watching YouTube videos in their smartphone or tablets. This causes more children are now having physical inactivity and even leading to obesity in such young age. So, in my opinion, we need to give daily vitamin D3 supplementation for our children and encourage them to play outdoors more often when possible to get their sunlight. The American Academy of Family Physicians suggests that we may begin with giving around 400 international units of vitamin D3 per day for infants, children, and adolescents. Well, there are still no strict guidelines about the vitamin D3 supplementation in Indonesia, but we have to pay more attention to tolerable upper limit or TUL suggested by the Indonesian Association of Rheumatology to prevent any adverse effects of oversupplementation of vitamin D3. Having said that, the tolerable upper limit is around 2,500 international units of vitamin D3 per day for children aged between 1 until 3 years old and 3,000 international units of vitamin D3 per day for children aged between 4 until 8 years old and 4,000 international units of vitamin D3 per day for children aged 9 years old and older. In addition to dietary sources and supplementation, the exposure to ultraviolet B sunlight as little as 10 until 15 minutes per day provides children and adults with greater amount of vitamin D. So, in conclusion, dear parents, put your children's smartphone away and take them playing outside in the sun. Remember, it does not always need to be a fancy, expensive retreat out of the town. It can be just as simple as walking or cycling around the neighborhood for 10 until 15 minutes per day, depending on the sun. Well, that's all for today. I'm going to enjoy the sun. Have a good day and thank you.